Uganda Martyrs Hospital Lubaga, founded in 1899, is one of the oldest hospitals in Uganda, having existed for over 100 years. It was founded by the missionary sisters of Our Lady of Africa, also known as the White Sisters. The sisters started their journey in France via the Suez Canal and the Red Sea to Zanzibar and first set foot at Bagamoyo. In December 1941, during an outbreak of pneumonic plague, two white sisters contracted the disease. The attending physician, Dr. Ahmed, saw no chances of survival for the sisters. There were no antibiotics by then, and Christians started a novena of prayers to the Uganda Martyrs. The people prayed day and night for the sisters. Within 3 days, the sisters recovered completely, and the plague, which had killed hundreds, disappeared. Dr. Ahmed and two other English doctors gave evidence that the medicine given to the sisters, the only drugs available at the time, were insufficient to have an impact on their recovery. The cure of the sisters was officially acknowledged to be a miracle attributed to the help of the Uganda Martyrs. Dr. Ahmed witnessed the canonization of the Martyrs of Uganda in St. Peter's, Rome. Lubaga Hospital is a general referral hospital. It is a Catholic, private, not-for-profit hospital.
And its uniqueness is in the sense that it is particularly meant to care for the less privileged, the poor.
Our services are based on Catholic values and principles. We provide quality, affordable health care services, especially to the less privileged members of the society. Lubaga Hospital employs specialists and consultants in major medical disciplines, as well as very experienced nursing and midwifery staff. Through the years, Lubaga Hospital has developed further and now offers medical, surgery, pediatrics, which deals with the medical care of infants, children, and adolescents, obstetrics, which deals with the birth of children and with the care of women before, during, and after they give birth, gynecology, HIV/AIDS care.
The kind of care we have for HIV/AIDS patients is offered in our public health department, and we have an ART clinic. We have a doctor there, we have nurses there, we have free drugs which are donated through Uganda Catholic Medical Bureau. We have free tests when they have to do CD4 counts, free TB testing, and we really are open to anyone who has HIV/AIDS.
Physiotherapy, ear, nose, throat services, public health, dental services, prevention of mother-to-child transmission, and ophthalmology, which deals with the treatment of disorders and diseases of the eye. The hospital also runs health training schools with courses in enrolled nursing and midwifery, registered nursing, registered midwifery, theater assistants, and laboratory assistants. The graduates of the school will be absorbed in the Ugandan labor market and will offer services to the population in different health institutions. The outpatients department attends to about 475 patients daily and works 24 hours a day. Specialist clinics in the outpatient and public health departments include diabetes clinic, tuberculosis clinic, and family planning services. The inpatient section is categorized in wards. Lubaga Hospital has two surgical wards, the main surgical ward and the pediatric ward that caters for children. The medical ward admits patients after different diagnoses. In the children's ward, care is given to babies from birth up to the age of 28 days. This is done in the nursery unit, labor unit, and St. John Bosco ward. The maternity ward is one of the busiest departments in the hospital. It caters for approximately 7,000 births a year. The hospital has a social worker in charge of providing social welfare services to needy and vulnerable patients. This includes home visits, counseling care for abandoned patients, and identification of foster homes for abandoned children or newborn babies.
The mother with a triple HC approached us last year when he had given birth to 3 children. Her husband had abandoned her.
Omuwala kyava yamuyita dokita lyangu wona azadde abaana abange nze maama nze taata nze jjajja nze singa buli kimu kino kimmanja kiri kimmanja nina okugula kino sukaali sabbuuni nva mmere bwe ŋŋenda e Lubaga buli kimu bakimpa sisasula bampisa bulungi.
We also follow up some patients at home, particularly those that are chronically ill and unable to visit the hospital regularly.
Fred Mugerwa is our old client, and we have been giving palliative care to Fred for over 6 years now.
Ab'e Lubaga bwe tubadde tukyali kumpi nga bw'oba oli bubi n'okuba essimu baleeta ambulance ne bakunona ne bakutwala mu ddwaliro. Embeera y'ekibuga yannema nga tetusobola kubeerayo bwe twasalawo okudda mu kyalo. Bwe tutyo tebaatusuulirira ne batunoonyaayo era ne batuzuula era ne bongerako okutujjanjaba ne basindika abasawo ne bajja ne bakujjanjabirako awakasenga obulwadde bwa butonotono okugeza kati ng'amabwa bajja ne baganyigirawo awaka ate ne bayigiriza n'omukyala okugalabirira n'okumuwaako ku bikozesebwa bye baba basobodde n'aba ng'asobola okukubeezaawo okutuusa ate lwe balidda.
N'akagaali ako katambulira ka wheelchair Lubaga hospital eyakatuwa twali tetulina kagaali era tubeebaza nnyo.
Additionally, the hospital has an outreach program which allows us to take healthcare services to the community. We still hope to set up special needs clinics to cater for the increasing need of these services by the population, such as a sickle cell clinic. The maternity section of the hospital deserves special mention as it has highly contributed to lowering the maternal mortality rate in Uganda. A new maternity wing is currently under construction, and we hope to continue providing exceptional services at the ward. The great achievements in the maternity section are attributed to several factors, including continuous education of midwives, availability of doctors and emergency medical drugs, availability of tools in monitoring the progress of labor, and best practice measures in infection control. We at Lubaga Hospital are committed to a holistic provision of healthcare by ensuring treatment of the whole person, taking into account mental and social factors rather than just the physical symptoms of a disease. We provide treatment, prevention, health promotion, and training. Please visit our website www.lubagahospital.org. Lubaga Hospital, service with love.